Thank you, Governor Beshear, for having me today. As was stated, my name is Miriam Haas, and I am the nurse manager at Norton Brownsboro Hospital. I am here today to talk to you about what we are seeing now in the hospitals as compared to when COVID-19 started. I'll never forget getting the call on March 8th, 2020, that we had the first positive COVID patient in Jefferson County on my unit. I was at an event for my son and stepped out of the room to take the call. When I walked back in, I remember looking at my family and everyone there and thinking, they have no idea that everything is about to change for us all. Those first days and weeks were so challenging. As frontline, we were nervous about everything because it felt like procedure and treatment changed rapidly as we received new information on how to best treat the patients. The biggest challenge and fear for me and other frontline workers was the fear of the unknown. What could we be bringing home to our families? What could we be exposing ourselves to? Everyone saw what was coming out of New York City, and that feeling of impending doom will never leave my memory. We were also thrust into a different kind of nursing. Patients suddenly left alone to fight through sickness or to succumb to their illness alone. We went from being patient family-centered care to us as nurses quickly filling that role, being a patient's family while their real families were on Zoom. Every time we had a patient pass away from COVID, we would have just their nurse in the room with them holding their hand. The rest of us would gather outside the room and say a prayer for our patient that was passing, as well as our nurse that was in there with them, that they were able to bring peace and comfort to not only that patient, but to their family member in that moment. We work on a med-surg floor who typically sees patients who are fairly stable. Suddenly, we were caring for patients who became unstable very quickly and who would need to be transferred to the ICU just as quickly, while we were doing everything in our power to help them breathe. To say it's been a whirlwind and taxing is an understatement. Over the past 18 months since COVID started, we have been flooded with sicker patients, and our hospital volumes continue to rise. Our staff is exhausted and feeling burnt out, with many leaving the bedside altogether, which is adding a new challenge to this pandemic. These past few weeks, as we have been seeing more patients with the Delta variant, we have had to deal with a new problem: younger patients who become unstable more unpredictably. These patients tend not to have any other illnesses that contribute to their sickness. They don't really even have anything in common with each other, except that they have the Delta variant, and many of them are not vaccinated. With this new wave, we have the benefit of knowledge gained, but we now have the difficulty of our non-COVID patients being more ill than they were before, as many of them prolonged seeking treatment for their illnesses due to the pandemic and our rising COVID numbers. Many of our COVID patients voice their regret in having hesitation to get vaccinated and say if they had it to do over again, they would have received the vaccine. As a nurse, this has been the most difficult thing I have been through in my 13-year career. The things we have seen will never leave me and have impacted me and my team more than I can express to you today. The stress of leading a team through these trying times keeps me up many nights. Having to call a patient's family member to tell them that their loved one is being transferred to the ICU due to their diminishing condition and difficulty breathing, and staying on the phone with that family member as they sob because they can't be in the hospital with them is heart-shattering. We were called to be nurses, to serve our community, to make a difference, to provide our patients and families with exceptional care, and we will continue to do our best. We ask that you be vigilant. Know that people are very sick and that those who show up to care for you every shift are giving their all. 18 months in, scared of what's to come and exhausted from what they've been through. Thank you.